So, why is it important for us to learn about the signs and symptoms of a heart attack? One of the main reasons is because about every 40 seconds, an American has a heart attack in the United States. What do we do when we have signs of cardiac arrest? 911, most important. You can do hands only CPR, which is you push hard and fast, and you stay with that person until the EMTs or the ambulance gets there. A lot of people will be having heart attack symptoms and they'll just like be in denial basically, and they'll say, oh no, I'm just having anxiety, or I'm having gas, I'm having discomfort, and they will not call for help. What if I'm not having a heart attack? I'm going to go to the hospital, I'm going to be embarrassed. And so for that reason, they decide that they're not going to go to the hospital. And what ends up happening is that your symptoms can only get worse. And instead of having what we call a mild heart attack, it can be something that becomes worse, where they can go into cardiac arrest.
So the call to action is to know the warning signs of a heart attack and cardiac arrest. If you see someone exhibiting any of those symptoms of a heart attack or cardiac arrest, you should call 911 immediately.
And this is actually a personal question that I have. And I had been hearing the word nitroglycerin around. I wanted to know if any of you guys had some information on what is that? How does that have anything to do with the heart?
Yeah, absolutely. So nitroglycerin is actually used for people that have what is called angina. Okay, it actually dilates the vessels.
If someone is having a heart attack, is it safer to drive them to the ER or call 911?
I believe it's better to call 911. 911 would also direct you on what to do.
How do we take care of our heart when we already work very stressful jobs?
My favorite, yoga and meditation. Life has become so stressful. I tell people, everybody thinks that, they say, especially my kids, they say, woosah. Well, no. Meditation is much harder than woosah. It's going within yourself.
Stress can take away the joy of life, and really focusing on daily self-care is essential right now.
When you're having a true heart attack, you could be sitting down and you'll have shortness of breath, okay? You could be just doing nothing and you have that chest pressure and that jaw pain. Some people that are going through a panic attack, which is a little bit more than anxiety, it feels exactly the same as a heart attack. They can't tell the difference. And even when you come into the ER, we can't tell a difference until we run tests, until we do that EKG, until we do the troponins and all these labs. We can tell the difference because they're so similar. So if you're having an anxiety or a panic attack very frequently, it's really something that you want to get under control. So why is it important for us to learn about the signs and symptoms of a heart attack? One of the main reasons is because about every 40 seconds, an American has a heart attack in the United States. A lot of the patients don't recognize that they're having a heart attack, and so this makes it difficult for them to seek help. The good news is that if having a heart attack most people will survive a heart attack if they get to the hospital early enough. The average age for men is 45 and 55 for women. And there are some times younger people can have a heart attack, but it's related to a different condition, and we'll touch bases a little bit on that today. Our program objectives is to discuss the warning signs of a heart attack, go over the difference between a heart attack versus a cardiac arrest, and when to call 911. Like I said earlier, one of the reasons we should know about heart attack is because 1 in 4 African Americans will have a heart attack in the United States. 1 in 6 Native Americans are at risk for heart disease and heart attack, and 1 in 5 Latino. The other fact to know is that women are more likely to have a heart attack than men and everyone else. And so it's important for us as females to know the signs and symptoms and get help as soon as possible. Okay, so the first signs and symptoms of a heart attack that most people know is they get this crushing chest pain, and it feels very uncomfortable. Some people, they feel like they just had a very large meal and that they're bloated, and they just think, oh, it's just gas, and so they think nothing of it. Another sign and symptom is that you will have pain in your jaw, down your shoulder, and down your arm. Some people will have shortness of breath with the chest pain, others will not. Breaking out into a cold sweat, feeling lightheaded. It just feels like a crushing pain, and it's important for us to look at those signs and not take them very lightly. Women will experience the signs and symptoms of a heart attack a little different. So you may not get any shortness of breath. You may just feel nauseous and have some vomiting. You may have this pressure in your chest, but it's not severe pain. You may just have numbness or pain in your arm, dizziness, lightheadedness, or fatigue. And what I'd also like to mention is that I'd like to add to the slide is that people with diabetes, they may not feel the crushing pain. They may even have lighter symptoms that they may just decide, oh, this isn't a heart attack. I just don't feel well. But it's important for them to realize that it is a sign of a heart attack and that they should call 911. I'm going to show you guys a quick video about what it may look like or feel like to be having heart attack symptoms.
Don't hit your brother. You have to eat something. Here. Okay, 5 minutes to carpool. Where's my coffee?
You okay, Mom?
Oh, I'm fine. Sandwich orders. What do you want?
Almond butter and jelly. Oh, Daddy. You sure you're okay?
I'm fine, sweetie.
I am so late. Hey, buddy, how you doing? Hey, honey. You okay?
Yeah, I'm fine.
You sure?
Oh, yeah. Here.
Acai, my favorites. See you guys later.
Wear your shoes. Put your shoes back on, please. Go help your sister. We're going in 3 minutes. Oh, my God, what am I doing? I forgot to cut off the crust. Voila. Shoes on, potty if you need it. Honey, get your sister. Your shoes. Nobody move. I'm getting a dustpan.
Mom! I think you're having a heart attack.
Honey, do I look like the type of person who has a heart attack? Sit down. Totally fine. Don't forget to wear the high socks with the shin guards.
Forget about the shin guards, Mom.
Come on, Mrs. Underdog is not going to wait. Oh. Okay. 9. 1. Hi, sorry to bother you. I think I might be having a little heart attack. Nothing really, just some nausea, tightening of the jaw, dizziness, shortness of breath, muscle pain, achiness, this terrible pressure in my chest. Oh, really? They can be here in how long? 2 minutes. Can you make it 10? I thought I had gas. Turns out I was having a heart attack. Heart disease is the #1 killer of American women. So now I take care of my heart, and I tell the women in my life to do the same.
Sounds great, by the way.
That's nice, sweetie, but that's not my heart. That is. Make it your mission to save your life and the lives of the women you love. Find out more from the American Heart Association at goredforwomen.org.
Great. I know that the video was trying to be funny, but it can be very serious if we prolong not calling for help. So let's talk a little bit about what causes a heart attack. So the main cause of a heart attack is blockage to one of the arteries on the heart. I'm just making this in very simple terms. There are medical terms, but I want to, for our entire audience to understand, I'm going to put it in very simple terms, which is the arteries of the heart get blocked by plaque, which is cholesterol, and the blood supply doesn't reach a part of your heart, and that causes you to have a heart attack. And that's when you feel the pressure. There are a lot of risk factors that can contribute to someone having a heart attack, such as some that we can prevent and others that we can't. One, age, we can't change. However, we can change our diet and what we put into our body. Being an African American woman, we can't change. However, we can do exercise. Being a man or having a family history, we can't change, but we can stop smoking and choosing a better lifestyle. So there are things we can change to prevent a heart attack, and there's others that we can't, but it's important to know the signs so that the earlier we get treatment, the better our outcome will be. So a lot of people associate a heart attack with cardiac arrest. But today I just want to go over a little bit what the differences are. So like we said earlier, a heart attack is a circulation problem. That means that the blood flow is not getting to all parts of your heart. Cardiac arrest is an electrical part problem, which means that the heart malfunctions and suddenly stops beating. However, a heart attack can cause cardiac arrest. So let's learn the warning signs of cardiac arrest. So cardiac arrest is different than a heart attack. As we saw by the video, she was still able to do things and call. But when you have a cardiac arrest, it is sudden. It's like you get this sharp pain and you suddenly are unconscious. If you see that happen to anybody, you want to stay with that person. You want to get help right away. You're going to shake that person as hard as you can. You can do a sternal rub where you rub the chest really hard to see if they respond to you. And if they don't, you are going to call 911 because normally that person isn't going to stop breathing. And you're going to stay with that person, get somebody to call an ambulance for you. And if you know CPR, just start CPR right away. So what do we do when we have signs of cardiac arrest? 911, most important. You can do hands-only CPR, which is you push hard and fast, and you stay with that person until the EMTs or the ambulance gets there. Point number 2, don't wait. Call 911. If you don't know if somebody's having a heart attack versus cardiac arrest, it doesn't matter. Either way, they're going to need help. So just dial 911, stay with the person. If you see that they're breathing and they have a pulse, of course you're not going to do CPR on them. But if they become unconscious, you're going to stay with them and start CPR and until the EMTs can come and help you out. So a lot of people will be having heart attack symptoms and they'll just like be in denial basically. And they'll say, oh no, I'm just having anxiety or I'm having gas, I'm having discomfort, and they will not call for help. One of the biggest deterrents is that they're like, oh, what if I'm not having a heart attack? I'm going to go to the hospital. I'm going to be embarrassed. And so for that reason, they decide that they're not going to go to the hospital. And what ends up happening is that your symptoms can only get worse. And instead of having what we call a mild heart attack, it can be something that becomes worse where they can go into cardiac arrest. Another concern why people don't call for help is because of financial situations where they feel, oh, okay, I'm not going to be able to afford this, or I can't I don't have, or like immigrants, if they're not United States citizens, they feel afraid to call for help. But do not wait. Most important thing, if nothing else, that you learn from this presentation is just get help as soon as possible.
So these are just the takeaway messages. Basically, I'm going to review everything that Maria discussed throughout the presentation. So before there's an emergency, you should make sure that you're looking out for the signs of the heart attack. So the shortness of breath, the chest pain, the symptoms that Maria went over. For the upper body, it could also include pressure, tightness of the jaw, neck pain. Patients may also feel nausea or vomiting. Shortness of breath may or may not be a symptom, like Maria stated earlier. It's important to know which hospitals are in your community so that if this does occur, that you're aware of the hospitals and where to go, and where there are 24-hour emergency services. Remember, you should call 911 in an emergency situation, including situations if there's someone who's unresponsive, if you're just not sure and they're not breathing. And as Maria mentioned, you can also start CPR if you do know how. Okay, so the point three, embrace life's simple 7. These are the recommendations to reduce the risk of heart attack. So number 1 is to get active. The whether it's exercise or walking, any type of activity that you can tolerate, eating better, choosing more highly nutrient dense foods, low in saturated fats, low trans fat, cholesterol, and salt. It's important to begin reading labels to just understand what's inside the foods that we're eating. It's important to lose weight or to maintain a healthy weight. Number 4, for those who smoke, to stop smoking or to avoid tobacco products or smoke. Number 5 is to control cholesterol, which can be done also through the types of foods that you eat. Number 6, controlling blood pressure, reducing sodium. Also, nutrition is very important. Treating the blood pressure, if you do have it, that can be through medication and also through exercise. And also to reduce blood sugar, to keep your blood sugar within a normal range, also includes eating low foods not high in sugar and low in carbohydrates. These are some of the ways to reduce the risk of heart disease. And as Maria mentioned, some of them are things that you can't change, such as gender, race, age. These are some of the factors that you can change. Always take your medications as prescribed and have an open communication with your providers. So the call to action is to know the warning signs of a heart attack and cardiac arrest. If you see someone exhibiting any of those symptoms of a heart attack or cardiac arrest, you should call 911 immediately. The 7 steps to reduce heart attack that we just discussed are also important, and joining the 2HC program. And why is it important to join this program? The Healthy Hearts community provides guidance and educations to help decrease the risk of heart disease. So if you don't understand the proper steps to take or don't know how, this is a good program to join. They help with up-to-date information on nutrition and exercise, and can also help with managing risk factors that control blood pressure, diabetes, teaching exercises and diet, nutrition, medication management and compliance, taking the medications as the doctor has ordered and making sure that you're up to date on refills, and also managing stress can also reduce the risk of heart disease.
One question just to get the ball rolling. And I know we talked about some of the activities to do to help reduce any heart disease. What are those activities that we should avoid? Those activities that we shouldn't be doing, that can maybe contribute to a not so healthy heart.
That is a great question. Thank you, Stephanie, for that question. So, after a heart attack, you will have some very specific things that you should and should not do. So, of course, if you have a mild heart attack, most people will go back to living their regular lives. They will need to change the way that they eat, of course, and add some exercise. Um, and they will be on a medication regime where they might have to be on a blood thinner or something. It all depends what type of heart attack you have. However, there is really nothing that we will say, oh, you can't do that. You know, if the more active you can be, the better. The more healthier choices you make when it comes to your lifestyle and your diet, that will help you to prevent future heart attacks. I think the only thing is like the diet and the smoking is things that you shouldn't do after you have a heart attack.
Awesome. Thank you. And this is actually a personal question that I have. And I had been hearing the word nitroglycerin around. I wanted to know if any of you guys had some information on what is that? How does that have anything to do with the heart?
Yeah, absolutely. So nitroglycerin is actually used for people that have what is called angina. Okay, it actually dilates the vessels um, of the heart and other places so that you have more flow. So even though people associate that with heart attacks, that's like pre heart attack. That means you have some type of heart disease and that you have to be on this medication. But if you're having a heart attack, they usually tell you to symptoms of a heart attack. They usually tell you to have one under your tongue about every 5 minutes. But it's not for everybody. So I don't want everybody going out and saying, asking their doctor for nitroglycerin. You have to have a diagnosis because it's a prescribed medication.
If someone is having a heart attack, is it safer to drive them to the ER or call 911?
I believe it's better to call 911. 911 would also direct you on what to do. So they would be a really great resource, because if someone is going through a heart attack and they're in a car with you and looking at how far you may need to drive, being on the phone with 911, they will definitely direct you in everything that you need to do. And it's probably, if you knew CPR, you needed to do it, then being at home to be able to do it as opposed to in the car would be more ideal. So I don't know if anybody want to add.
No, that is great. 911. That was the most important slide that we had. Regardless if you think it's a heart attack or cardiac arrest, 911.
And also to add, the ambulance would be able to, they have certain things that you wouldn't necessarily have in the car. For instance, if they needed oxygen or if they needed some type of medicine, even if you're mentioning like the nitroglycerin, if it wasn't actually a heart attack yet, those are some of the things that you wouldn't have compared to the ambulance having. So that'd be the safest.
Awesome. So Tyreek in the audience says, heart disease runs in my family. How should I go about detecting on how healthy my heart is and how to tell them when something is going bad with my heart? I'm also in my early 20s, so should I have anything to worry about right now?
Tyreek, thank you. That is a great question. That means that you have a family history because that heart runs in your family. So what you want to do is, there's really no way to say, okay, Tyreek, you're going to have a heart attack, but you can start early in your 20s with great exercise, avoiding bad food, like eating fried foods every day, Wendy's and all that junk stuff, right? And just exercising, avoid smoking, and those will decrease your risks, even if you have a family history of getting a heart attack when you're older.
And also I'd like to add like just paying attention to your body and noticing like things that are normal and abnormal. So say you are being physically active and you notice that, you're becoming more short of breath or you're having like a slight discomfort. I think it's important to start writing those things down and discussing with your doctor that you do have a family history. And if you start to experience symptoms, and that way you'll be able to know, okay, I've experienced this when I'm on the treadmill or I'm sitting down. So just paying attention to those signs are really important in knowing your body. And also everything Maria said, prevention is the most important thing despite your history.
And I just want to add to that, having your yearly appointments, being able to know what your blood pressure is, I think it's a key. And now with all the stress and craziness that's been going on in our life, and even looking at, one of the effects of the vaccine is myocarditis and pericarditis. And so there's definitely, I feel like there's so many changes that's happening in our lives that, age, you say 20s way back 30 years ago, you're like, oh, you really expect a heart attack. But now there's been younger people having heart attacks. So, like it was stated, just paying attention to what your body's feeling, and not ignoring, but expressing, what's there for you. And definitely staying, just, being aware of your blood pressure, knowing what normal is, and um, checking it periodically, I think is a good idea.
Awesome. Thank you, ladies, for that. That is such a big deal because we tend to put an age on being sick. And so just hearing that is very important.
Yeah, but
Son-
I'd also like to add too, that there are people that are born with arrhythmias, right? So those are things that we did not discuss today, but that can cause heart cardiac arrest. So if you, like Velma said, if you notice anything different and you're feeling short of breath and you have any of the signs that we discussed, it wouldn't hurt to mention it to your PCP and say, let me keep an eye on this. And there's tests that they can run and tell you what's going on.
Awesome. Thank you so much. Sandhya had a question. She said, "Hi, everyone. I'm in my late 20s. I've been experiencing tight chest pains throughout the day. They come and go. Should I be concerned about it being a potential heart attack?"
Sonia, that's a great question. So again, I don't know your entire medical history. So like, I don't know if you have a family history. Um, if you, there are other things that are very similar to heart attack, but if you're having these, definitely call your doctor and say, I've been experiencing these chest tightness, because anxiety can also cause the similar, very similar symptoms to a heart attack. But that doesn't mean that, hey, I can't go see this because I think it's anxiety, right? We don't want to diagnose you with anything, but it's definitely something that needs to be brought up to your doctor as soon as possible, rather than just saying, hey, it's nothing. And you can go from there, because there are blood tests that they can do. There's like a Holter monitor, all types of things that they can do to tell you, hey, it is something to do with your heart. Let's get ahead of it so that we prevent a heart attack. And I hope that answered your question. If you want me to elaborate, let me know.
Mm. Yeah, I also wanted to add too, a lot of times when you're having GI symptoms, there's definitely feelings of near the heart that relate. So usually for in your 20s, they probably would check out, you're looking at what you eat, and whether it's GI, and as well as explore your heart.
Awesome. Thank you so much. Heart of a Giant said, "What's arrhythmia and how do we detect those?"
Okay, that's a great question. Thank you. So an arrhythmia is an irregular heartbeat, right? So there's different kinds, and the simplest way to detect that is you come in, you tell your doctor, my heart's been racing, or I feel a skip. Some people will feel like a skip when their heart beats. And we do just an EKG, which is when they put the little stickies on your chest and we see the rhythm. And then you can be diagnosed saying, but there's different types of heart arrhythmias. So there are some that are benign and some that are very dangerous. So if you experience those, that's something else that you really should be aware of, and let your provider know so that they can be on top of things for you.
Thank you, Maria. Another question that is coming up as well is, how do we take care of our heart when we already work very stressful jobs?
Yes. So my favorite, yoga and meditation. Life has become so stressful. I tell people, everybody thinks that, they say, especially my kids, they say, woosah. Well, no, meditation is much harder than woosah. It's going within yourself and taking time for yourself to breathe and to listen within. And that does wonders for your heart. Um, moving your body. You don't have to go to the gym and lift 50 pounds, 100 pounds. Just doing gentle stretches in the morning, listening to your body is the best way that you can to take care of your heart. Anybody else want to add to that?
Yeah, I think those are really good suggestions. And also to sometimes journaling can help just getting your emotions out of your head and onto paper. That way it's not filling, your headspace as much, but you're releasing it somehow. And also just being hydrated. I know that can help as well, because just being hydrated helps so much more than we realize. So I would recommend adding journaling, staying hydrated, and also to Sandia, to really know when you're having those symptoms, like to see if it is related to any type of anxiety, like is it during work hours, just trying to write that. So when you do talk to your doctor, that you have a good picture of when these symptoms are happening.
And I just want to add to that is doing things that you enjoy. Stress can take away the joy of life, and really focusing on daily self-care is essential right now.
Thank you. That's helpful even to myself. Thank you so much. So Lewis mentioned I get shortness of breath climbing stairs and I'm overweight. Should I worry that a heart attack could be imminent?
Okay, Lois, thank you for that question. Um, I know that we were stressing that if you have signs of a heart attack, call 911. There are a lot of things. So just having shortness of breath doesn't mean you're having a heart attack, right? Because you could have asthma, you could have COPD, you could have, sometimes being overweight can cause shortness of breath, and it has nothing to do with having a heart attack. But it's nothing that you want to ignore, okay? When you're having a true heart attack, you could be sitting down and you'll have shortness of breath, okay? You could be just doing nothing and you have that chest pressure and that jaw pain. So I hope that I wasn't unclear when it comes to those things. If I only get shortness of breath when I'm going up the stairs, that's probably not that you're going to have a heart attack. It just means that maybe you need to lose a little weight, or just talk to your doctor and see, hey, this has been going on more frequently, it's getting worse, and then you can come up with a plan to see if you have other risk factors that can contribute to a heart attack or not.
I just want to add, if this is something totally new for your body, I would definitely go see my provider. And I don't know if this has been going on for a while. I don't know your age, but it's definitely worth following up with your provider to look at how can you improve your house? How can you be at your best? And we always want to be at our best because of the stress and everything that goes on in our life. But yes, definitely follow up on this, because it doesn't, like Maria said, it doesn't mean you're having a heart attack, but yet your body's working hard and you want to do stuff to really help your body function at its best.
Thank you, Velma. Thank you, Maria. We have a few more questions before we close out. One of the last questions is there any specific over-the-counter medication I should be taking? I know a lot of us will do a Tylenol or an Advil with a headache or a back pain, but are those medications that can contribute negatively to our heart health?
I'm sorry, are they asking if they should be taking something to prevent a heart attack, or what was the question? Can they read it?
Yeah, more like is there medication that is not good to take when we already have underlying health issues?
Oh, that are not good to take. Yeah,
Yeah.
well, there's a ton. Believe it or not, you will go to GNC and they have all types of vitamins and stuff, but most of the stuff that you see today in the stores, they're not even FDA approved. They don't have to go through anything. Um, a lot of it is advertising. So what I tell people is, um, unless you speak to your doctor, that you really shouldn't be taking anything. You know, you can get most of everything that you need through your diet. Okay, so if you have to take Tylenol every day, then there's a problem. There's an underlying problem because Tylenol is not going to affect your heart, but it affects your kidneys, which controls the blood pressure. So if one thing leads to another, then leads to another, and then eventually it ends up affecting your heart in some way. So what I tell people is, if you're taking something every single day, like Tylenol or ibuprofen, you should talk to your PCP to see what else is going on.
And also note that medicines have side effects. So, and talking to your PCP, maybe there's something that you're already taking that a side effect's developing, and just being able to look at the whole picture is definitely important to talk to your.
Thank you. Thank you, Velma and Maria. The next question is, I know we were talking a little bit about anxiety and other things that can cause pressure in the chest. Just anxiety, panic, stress, in comparison to a heart attack. Are there any like anything that's different between the two that can help us say, no, this is definitely stress versus this is a heart attack?
Well, like we mentioned before, so if you, some people will have an anxiety attack related to certain things, and so if there's a pattern to when you're getting your chest pressure, or it's just like anxiety is a little different. Like you don't really get the jaw pain, but you're just like your palms are sweaty, you're having shortness of breath, but your mind is very cloudy. If they're so similar that I don't want to say just look at it as an anxiety attack. If you're having these symptoms, you should talk to your PCP. The only real definitive way to tell the difference is if we drew your blood and we did some tests to say, you know what, we've ruled out that your heart is fine. So now we can say it's anxiety, right? But until they can rule out that your heart is healthy, we can't definitively say, oh, you have anxiety. So if you're having the symptoms, it's definitely something that you should get checked out and say to your doctor, oh, you know what? I get shortness of breath. I get the chest pressure. Again, there's so many factors on how to decide, is it anxiety versus heart attack.
And
Awesome.
I also think about how anxiety definitely makes you secrete certain hormones that affect the rest of your body. So anxiety, you're kind of tense. You're going maybe through the flight or fight kind of experience in your body. And like Maria has suggested, like the meditation, like if it's anxiety, then meditation will help a lot with being able to acknowledge that it's anxiety and be able to calm your body in a way that helps you to be in a better place. So I take anxiety pretty serious because it does have other effects on your body that can lead to other things. So it's worth following up on.
Some people that are going through a panic attack, which is a little bit more than anxiety, it feels exactly the same as a heart attack. They can't tell the difference. And even when you come into the ER, we can't tell a difference until we run tests, until we do that EKG, until we do the troponins and all these labs. We can't tell the difference because they're so similar. So if you're having an anxiety or a panic attack very frequently, it's really something that you want to get under control, because like Velma said, the fight or flight state that you're in is putting stress on your heart, because we have people that will be in a panic attack and their heart rate is over 130. That's a lot of work for your heart. And the more your heart is working, it can cause your heart, it's a muscle, right? So if it's beating 130 beats per minute, and this is happening you 2-3 times a week, you're going to have an enlarged heart. There's so many things that can go on. So it's not something you should take lightly. Talk to your doctor. Thank you very much, guys. I hope that everybody was able to take something out of this presentation.